In this lecture, Dr. Jason Fung discusses novel management of type 2 diabetes with special focus on dietary interventions.
So I just wanted to start today with a quote from Mary Mead, and she's an American scientist who said that never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has, right? And that's what we're trying to do today. And I'd like to thank Professor Noakes for putting this on, because that's what we're trying to do. We're trying to reclaim our health, and we're trying to learn how to do that. So this is a talk about type 2 diabetes. And it's about the etiology and reversibility of type 2 diabetes. And what we're actually going to do is expose the two big lies of type 2 diabetes. So this is type 2 diabetes. So what you see here is the fasting glucose. So there's actually two things that happen with type 2 diabetes. There's two phases that happen with type 2 diabetes. You see this first phase where it goes up very, very slowly. So this is diagnosis. And prior to that, you have a very long, gentle upslope of your fasting glucose. And what that reflects is the increasing insulin resistance that develops. And then all of a sudden, you get this very sharp uptick, and that actually reflects the beta cell dysfunction. So the beta cells aren't producing enough insulin, and your blood sugars all of a sudden go up very high. This is what happens, and you saw this graph yesterday, and you see that as you go from lean to diabetic, the insulin resistance slowly increases. And this is what happens to the beta cells. So the beta cells, in a normal lean person, as the glucose goes up, so this is the open circle, the insulin goes up. So as you become more and more diabetic, you go from impaired fasting glucose to overt type 2 diabetes, what you see is that your insulin starts initially by going up very high in response to this glucose, but at some point, as the glucose goes up, your insulin level actually dips, right? So as opposed to the resistance, which gradually goes up, your insulin level actually starts to dip at the end, and that's what leads to that very sharp uptick. And the question is why? So when we talk about type 2 diabetes, there's one thing that you always hear. It's not actually true, which makes it a lie. It might be an inadvertent lie, but it's a lie nonetheless. And that type 2 diabetes is a chronic and progressive disease. And that's what they all say, but it's not actually true. And I can actually prove it to you quite easily. So you can look at studies of bariatric surgery. So this is where you cut the stomach into the size of a walnut, and basically they can't eat. And what happens? Well, the diabetes actually goes away. So if you look at this study, which was published in the New England Journal of Medicine in 2012, what you see is that if you do intensive medical management, I should say, you basically nothing really happens. But if you do Roux-en-Y surgery, or if you do a sleeve gastrectomy, so these are two different types of bariatric surgery, well then the diabetes essentially goes away in conjunction with the weight loss, right? So at about 12 months, you see that most people are actually off all their medications. So to all intents and purposes, cured. And this happens, and we've known this for a long time, because studies going back even to 1992 have shown that there's two things that are actually quite interesting about bariatric surgery, which is one, the diabetes, this is the glucose, you see that it drops very, very quickly. So within a couple of weeks, the diabetes actually disappears. So the patient may still be 450 pounds, but the diabetes is gone. And the other thing is that it's an extremely long-lived treatment, right? So it goes down and it stays down. So again, to all intents and purposes, cured. Now, I'm not saying that everybody needs bariatric surgery, but what I'm saying is that there's something happening here which completely reverses the diabetes. So to say that it's a chronic and progressive disease is actually not true. You can do the same thing with gastric banding. So this is the more recent. You put a band in the stomach and you squeeze it down so they can't eat. And what you see is that, again, the blood glucose falls down. So there is a cure. It's not chronic and progressive. And you can look at studies of fasting. And this is actually my patient, Margaret. And we started with her taking 120 units of insulin a day, plus 2 grams of metformin. Her hemoglobin A1C was 7%, and 4 weeks later, she was on 0 insulin, no metformin, with an A1C of 6.6%. And a year later, down some 64 pounds, her hemoglobin A1C is 6.2%. So again, very, very rapid relief of the diabetes, and it's long-lived. In fact, if you go back almost 100 years, a fellow by the name of Joslin, a little-known diabetologist, wrote in 1916 that temporary periods of undernutrition are helpful in the treatment of diabetes will probably be acknowledged by all. So he thought it was so obvious that undernutrition is going to cure. In fact, he actually specifically talked about fasting, which is crazy, right? But fasting, it was so obvious to him, he thought that everybody was going to do this. What happened, of course, was that they discovered insulin, and then everything went the way of insulin. If you look at food rationing during the World Wars, so this is not carbohydrate restriction, this is everything restriction, right? So you're talking, nobody had any protein, nobody had any carbohydrates, nobody had any fats, people were starving. But if you look at type 2 diabetes, what happens, of course, is that during the war and during the food rationing, you had very little type 2 diabetes. So again, to say that this is chronic and progressive is simply not true. In fact, you can compare fasting and bariatric surgery. And they did a study where they actually fasted these people prior to surgery. And this was because they wanted to reduce the surgical mortality, right? So you shrink the liver a bit, you lose a bit of weight, there's less surgical complications. But what's really interesting about the fasting is that if you look at the weight loss, so this is the fasting, this is after surgery. The fasting actually did better. There was more weight loss. And this is the glucose, the daily glycemia. It's actually way better than post-surgical. So, of course, they went ahead and did the surgery and everybody got better, right? And the third one is a low-carb, high-fat diet, ketogenic diets. What happened? Well, again, a patient, 27 years old. She was actually a graduate student in physiology. So she got diagnosed. She went to her doctor. Her hemoglobin A1C was 10.4%. She got started on 3 medications. She said, forget that. I'm going on a ketogenic diet, very low carbohydrate diet. She lost 20 pounds, took herself off of all her medications. And what happened, right? Her hemoglobin A1C is 5.5%. So again, for all intents and purposes, with the low carb, high fat, her diabetes was cured. Well, that's funny because I thought it was a chronic and progressive disease, right? So if you look at what cures diabetes, you can actually say these things are a cure. And if I was to say to somebody that, well, I lost 50 pounds and my diabetes went away, you wouldn't say, wow, you're lying, right? Diabetes never goes away. It's obviously true. But what do we do instead? We give insulin, we give drugs, and we give low-fat diets, right? But what happens if you give people insulin? Do they say, oh, I took 100 units a day of insulin, and 2 weeks later I took myself off, I'm fine now? That never happens, right? Or, oh, I went to a low-fat diet, and I'm cured now, I'm good. No, that never happens, right? So these things lead to a cure, and these things do not. So you'll never guess, of course, which way that we treat people, right? That's our treatment protocols, that's our research, and our current goal is to normalize the blood sugar, right? Who cares about the diabetes? Let's normalize the blood sugar. So the real problem I have with this all is that it gives people a sense of learned helplessness, right? So here's the American Diabetes Association, and they say, well, this is a fact. Type 2 diabetes is a progressive disease. You got it. Get used to it. That's the message, right? Don't fight it. Well, actually, it's a lie. It's not true. And the second thing they say is that, well, sometimes medications may be enough to keep the blood glucose normal, and then using insulin to get blood glucose levels to a healthy level is good, right? Not bad. The fact that you're using insulin is a good thing. And I'm like, what the fuck are you talking about, right? Like, you cannot be serious. If you're taking insulin, your diabetes is worse than it's ever been in your whole damn life. It cannot be a good thing. Anybody with an ounce of common sense will tell you that. But that's what the American Diabetes Association is telling people. And you Aussies are not any better. So this is what Diabetes Australia tells you, right? So over time, type 2 diabetes will need tablets and will also need insulin. It is important to note that this is just the natural progression of the disease. No, I didn't do that. Well, that's crazy, right? That's crazy. So the truth is actually that if you look at it, it's a curable disease, but it's a curable dietary disease, right? So you can't cure a dietary disease with medications. It doesn't work. For sure it doesn't work. The second big lie is that we need to take care of the blood sugars, right? That's what the goal of treatment is, to take care of the blood sugars, right? Get your sugars down. Take your insulin, get your blood sugars down. That's what we're all taught. And this is how we think about it, right? There's so many complications of diabetes. The eyes, the brain, the heart, the kidneys, you got amputations and so on. And they lump both type 1 and type 2 diabetes together, and what you get is these high blood sugars, which causes all these things like oxidative stress and advanced glycation end products, and therefore this leads to the complication of diabetes. So, logically, if you think this is true, then you get rid of the high blood sugars and you get rid of the complications, right? That's pretty simple. But it's not true. And we've known this actually for about 6 years. So if you go back to the Accord study, which was published in 2008 in the New England Journal of Medicine, what you see is that you can take thousands of patients and you can make their blood sugars better. So there's the control group, which has an A1C up here, and you, with high doses of medications, drop their sugars so that they actually get much better blood sugar control. So do they do better? No, not really. They do worse. And this caused a big splash when it came out that the hazard ratio of death, so these people with the intensive management were doing worse, right? They had an increased risk of death by about 22%. But it was far from the only trial that showed this. In fact, there was the Accord, the Advance, the VATT, and the Origin trials, which had all shown exactly the same thing, all of which came out roughly at the same time. So treating the blood sugars didn't do a damn bit of good, right? That much we know, okay? And this was the 7-year follow-up to the Advance study, which was published here in 2014 in the New England Journal of Medicine. And again, if you look at the two groups which are randomized, one to type blood sugar control, one to not type blood sugar control, well, what happens? Well, nobody can tell the difference between the two. So even 7 years out, you cannot tell the difference between good blood sugars and bad blood sugars. It doesn't make a damn bit of difference, right? And if you look at other studies, so Dr. Curry from the UK has published a lot in the Lancet, and you look at people who start on metformin and they add insulin or they add a second one, you can see that a low hemoglobin A1C is actually not good for you, right? So here you have the insulin group, and as you get a higher and higher A1C, yeah, you do worse. But you also do worse with a lower and lower A1C. So it's actually not that good for you. Here you have glucotoxicity, and my guess is that here you have insulin toxicity, right? It's not good for you, right? So as a physician, you think that this patient with a hemoglobin of A1C of 6% is doing fantastic. But they're not going to do any better than if their A1C was 10.5, right? They're doing terribly. Because the problem with type 2 diabetes is that we're not treating it, right? So whenever you have a disease, you need to treat it, the root cause of it. You can't just treat the symptom. If you treat the symptom, it doesn't do anything. So we know that type 2 diabetes is a disease of insulin resistance. But what do we treat? We treat high blood sugars, right? That's not the disease. What are we doing about the insulin resistance? It's almost like you have an infection. If you have a gangrenous foot or flesh-eating disease, you need to treat it with antibiotics. This infection is going to cause a fever, but you don't say, oh, let me give you some Tylenol, let me give you some acetaminophen, right? And then, no, I'm going to give you high-dose acetaminophen. Well, that leg is falling off, right? You need antibiotics because you're actually treating the cause here. But yet, for type 2 diabetes, which affects so many millions of people, we don't treat it at all. We just treat the symptom of the high blood sugar. What are we doing about the insulin resistance? Nothing. So what happens? The diabetes gets worse. That's exactly what's happening to all of your patients. So what happens over 10 years, 15 years, is that you start with metformin, then you take a few more medications, then you take insulin, then more insulin, right? Guess what? If you're ending up with 100 units of insulin a day, your diabetes is not better. Your diabetes is worse. Why? Because you never actually treated the disease, right? Because the disease is all about insulin resistance, and you're treating blood sugars. So again, in the Lancet in 2012, they did a study where they looked at screening for diabetes in shopping malls and so on. And they screened like 10,000 people. And it turns out that when you screen people, you don't actually see any benefit. And they're like, wow, that's pretty amazing. Well, if your treatment is all wrong, and you're not actually treating the disease, it doesn't make any sense to screen for it because you can't treat it anyway, right? And that's the real reason why this screening is completely useless, because they're just giving more insulin. So if you're going to start talking about how are we going to cure these patients, and why are we going to cure these patients, how it's happening, you need to start by looking at the treatments you know already work, right? So why is it that these treatments work? Why is it? Well, bariatrics is the easiest to study because it's the best studied, and there's a defined point where you can measure it. Well, what happens? Well, some people think it's due to the GI effects. So it's because of the hormones in the stomach, and when you cut the stomach, they don't produce these hormones, ghrelin, and so on. There's something called the foregut hypothesis. If food hits the foregut, and there's a hindgut hypothesis. Turns out it doesn't matter, because it doesn't matter whether you do a Roux-en-Y, whether you do a sleeve gastrectomy, or you do a restrictive. So there's two types of bariatric surgery. There's restrictive, and there's malabsorptive, right? So restrictive means you actually restrict whether people can eat, like a lap band, for instance. Malabsorptive means that you rewire their intestine so nothing gets in, and that's the Roux-en-Y. But it doesn't matter what you do. You can cut out stomach or you can not cut out stomach. It does well either way. So clearly, this is not the case. Maybe it's because you lose all that fat. It's due to the weight loss, right? This is the whole thing, that weight loss causes diabetes. And yesterday we talked about the fact that obesity doesn't actually cause diabetes. They're both diseases of hyperinsulinemia. But there is an idea that, well, if you just cut out that fat, well, then you've lost a lot of weight and the diabetes should get better. But it's not true, right? So there was a study published in 2004 in the New England Journal of Medicine where they did liposuction, because with this exact idea that you can remove fat cells, right? So you vacuum it out. So here's this big thick peel of fat. And what they did was they did liposuction, and you vacuumed it all out. You can't touch this big fatty liver, of course, because that's on the inside, but all this subcutaneous fat you take out. Well, according to this thought, well, if it's all due to weight, then that'll be good. But it turns out that when you take out all this subcutaneous fat, it doesn't do anything for your diabetes, right? So if you look at insulin resistance, if you look at blood glucose, there's actually no difference before or after. So it's not due to the weight. It's due to something else. The only thing that you can say causes the cure in bariatric surgery is this acute, profound caloric reduction, right? Because you're not eating, right? So Dr. Taylor in the UK at Newcastle did this study called the COUNTERPOINT Study. And what he did was he put people on these extremely low-calorie diets. And what was great was that the blood sugar came right down. So from 9.6, it went to 5.9 in only 7 days, right? These were extremely low 500 calories a day sort of diets. And what you can see is that the liver fat goes down preferentially. So you can see that there's a 30% decrease in liver fat. There wasn't a 30% decrease in the body weight, but in the liver fat, it does go down. And you can see that this is from yesterday, that if you take out the liver, you can shrink it very fast because most of it comes down within the first 2 weeks. That liver fat comes out preferentially far before the subcutaneous fat does. And if you look at the hepatic fat, for instance, it will go down 30% even while your own weight only goes down about 10%. So the body weight goes down, but the liver fat comes down more. And this is the reduction in liver triglycerides, so the fat in the liver basically. So you see this is normal. This is before the weight loss, lots of fatty liver here, and it goes right down. And what happens to the insulin resistance? This is from yesterday again, that this is a normal person. This is their insulin sensitivity. Before you lose all that liver fat, you have a lot of insulin resistance. When you lose all that liver fat, all of it comes back, right? So what you see again, the same thing that you saw before, Dr. Taylor saw that there's a significant improvement in the insulin sensitivity. So for those who weren't here yesterday, we talked about why fatty liver causes insulin resistance. And this is what we talked about. Well, if you have to think about what insulin actually does, right? So insulin, you eat food, the insulin goes up, and what they do is you store sugar as glycogen, then you store fat, which is de novo lipogenesis. So you produce triglycerides, you store it in the fat. And when you don't eat or when you're fasting, that will come out. You'll decrease your insulin, that sugar and that fat will come out. So in the normal situation, you have this, where the liver cells are easy under insulin, the food goes in. When they're fasting, low insulin, it comes out. But what happens, of course, under conditions of high persistent insulin, when your insulin is up all the time, what happens is that you get a huge fatty liver. So what happens is that insulin is having a hard time because you're trying to shove all this fat into this huge fatty liver. And it's really hard because just like blowing into that overinflated balloon, for the same amount of blowing in, you're going to move less air. That's insulin resistance, right? So for the same amount of insulin, it's going to be really hard to keep shoving it in. And when your insulin, if you don't take your insulin shots, for instance, all this sugar kind of comes flowing out. So you take more and more and more insulin to keep all this sugar kind of bottled up inside. And this is what leads to the vicious cycle, right? So you get the insulin resistance, you get the high insulin levels, you get the fatty liver leads to more resistance leads to high insulin, right? And that's what's happening. But what happens to the excess carbs in that liver? Well, there's only 3 possible ways it can go. You can burn it off. But when you're eating, when your insulin is high, you're not going to burn it off. There's no reason to, right? You're in a storage mode. So the second thing is that you can store it in the liver, and that's what you do, right? You get this big fatty liver. And the third thing you do is you can export it out. So your liver takes that excess fat and kind of sends it somewhere else. And one of the places it sends it to is the pancreas. So what happens is that you get fatty pancreas. When you start pulling out all that liver fat within the COUNTERPOINT study, what happens is that you get a slower decrease. So the liver fat comes down very quickly, but the pancreatic fat slowly comes down. And what happens to the beta cells? You can see that their function is now restored. So those beta cells weren't dead. They were just dysfunctional. they were being blocked by fatty pancreas. And that's the key, because there's two things that happen in type 2 diabetes. There's both the resistance and the beta cell dysfunction. And you can restore both with, in this case, acute caloric restriction. You can see this first phase insulin response, which is again another test of pancreatic function. You can see that it's much slower, but it does go up over time. So now you're actually reversing the two defects that happen in type 2 diabetes. So this is a twin cycles hypothesis that he published, but to make it a little bit easier, this is really what we're talking about, right? So you've got excessive carbs that go in, especially the refined ones, which leads to very high insulin, right? So again, insulin is the key here. It leads to fatty liver, which leads to hepatic insulin resistance, which leads to more insulin. This is a vicious cycle. It just keeps getting worse and worse over time. But there's actually two cycles that are happening here. You've got one, this is the fatty liver, which is called hepatic steatosis. And you've got hepatic insulin resistance, so that's one cycle. The second cycle is that you're sending this fat out to the pancreas. So this fat in the pancreas leads to beta cell dysfunction, which leads to high blood sugars, which leads to more insulin production. Now, it's being blocked because you've got beta cell production, but you're basically going to max out your pancreas to pump out as much insulin as it possibly can. So that's why, if you recall in the first slide, you've got very, very high insulin levels. So that's the twin cycles. And both of these are vicious cycles. If you don't treat it, it's going to get worse. So you have to actually break both of these cycles. And there's one key player in these, which is insulin, the excessive carbs, which leads to the insulin. See, the whole problem we have with type 2 diabetes is that we're treating the wrong thing here, right? We're treating the blood glucose, the blood sugar. The problem, to put it simply, in type 2 diabetes is that you have too much sugar, okay? But it's not just in the blood. It's everywhere in the body. So now what we do is we take the sugar out of the blood and we shove it somewhere else in the body, right? So if you imagine that you have a sugar bowl, right? If your body is like a bowl of sugar, when you eat, the sugar comes in and that bowl is full. So it will just spill out into the blood. But instead of getting rid of it, what you do is you take insulin and you shove it back into the body. And the body sends it somewhere else because it says, what am I going to do with it? It turns it into fat, it sends it to the eyes, it sends it to the kidneys, it sends it to the legs, it sends it to the heart. But you're not getting rid of it. So your bowl of sugar is still full. The next time you eat, sugar comes in, it spills out, you take more insulin, you shove it back in. And what happens is that you've got sugar everywhere in your body, right? So what happens? Well, everything just starts to rot. Your eyes, you get blindness, you get heart attacks, you get strokes, you get amputations, you get kidney disease. Everything starts to go. And all the while, your doctor's saying, look how good your blood sugar is. Your A1C is 6%. Good for you. The only person that feels better in all of this is your doctor, right? Because while your feet are falling off and you're going on dialysis, he's going, look at what a good job I did with you, right? And this is why they say it's a chronic progressive disease. It's a lie that they have to tell themselves, because it's obvious that it's a curable disease, right? But if it's a curable disease, why are all those patients getting worse? The only conclusion is that that doctor is a bad doctor, but he can't face that. Psychologically, you cannot face the fact that you're treating people wrong. So what you say instead is, look, it's a bad disease. It's a chronic progressive disease, and I'm doing the best that I can, right? Because psychologically, that's a lot easier to face. So they've lied to themselves. And it's not just the doctors, it's the diabetes associations, everybody. They actually believe this, right? Otherwise, they wouldn't put it on. They're not malicious, they're just deluded, right? It's different. So the whole problem is all wrong. You're not treating it correctly, because all you're doing is like if you have garbage in your kitchen, and instead of throwing it out, you put it under the rug, right? And then you say, wow, look how clean my kitchen is, right? And then when the rug gets full, you say, I need a bigger rug, right? Let me get a bigger rug, right? And then you say, wow, look how clean my kitchen is. Meanwhile, your whole house is just starting to smell, and you just don't know why. The key to the treatment of diabetes, of course, is to burn down all that sugar, right? And the only way you're going to get rid of the sugar is either burn it off or not take it in, right? Because this is the key right here, is the insulin. And the major part of that is the refined carbohydrates. It's not the only place, it's not the only piece of the puzzle, but it's a very big piece of the puzzle, right? So you have these people who go on low-carb diets, ketogenic diets, and they do fine because they're reducing their insulin, right? Because it's the insulin which leads to the insulin resistance, which is your major problem. So the solution is to lower insulin, right? This is what the bottom line is that it's the insulin which causes your type 2 diabetes. That's the bottom line, right? But we don't lower insulin. We give insulin with the mistaken assumption that we're doing patients good. So if we're starting to go towards a cure for type 2 diabetes, you got to understand what's causing it, right? So this is the thing. High insulin levels, excessive carbohydrates. That's what's going to cause your fatty liver. And that's what's going to lead to this whole twin cycles, that is the pathophysiology between type 2 diabetes. So once you understand that, it's really easy to look and say, well, how are we going to cure it? Well, that's pretty obvious then. Decrease your insulin and decrease your carbohydrates. But of course, that's not what we do, of course. We don't tell people to take less insulin, we give them more insulin. We don't tell people to take less carbohydrates, except here in this auditorium. We tell them to take more carbohydrates, right? 50% carbohydrates, 65% carbohydrates. Watch that dietary fat, right? You can't take too much fat. But the fat was not the problem. The problem was the carbohydrates. So this is the thing. When you start to decrease your carbohydrates, and sometimes you have to decrease it a lot, what's going to happen is you're preferentially going to release the fat from the liver. You're going to decrease your insulin resistance. You're going to take out the fat from the pancreas, and that's going to reverse your beta cell dysfunction. And therefore, your diabetes is going to get better. Now, instead of getting worse and worse and worse, you're now going to be able to drive those twin cycles in reverse, because you're going to get better. As you take out more of the fatty liver, you're going to get lower insulin resistance, which means your insulin is going to go down, right? So we're actually heading in the wrong direction. We're moving in the wrong direction. We're heading where the cycles are getting worse instead of getting better. And then you wonder why nobody's getting better. Then, because you don't know why everybody's getting worse, you call it a chronic disease. So this is the thing. The current treatment paradigm is completely idiotic, right? It's essentially like giving alcohol to an alcoholic, right? So if you have a disease where the problem is too much alcohol, if you take it away, they might get the shakes. And then you give them alcohol and you might say, wow, look how good you're doing with all that alcohol, right? I'm going to put you on a high-dose insulin infusion, high-dose vodka infusion, right? But it's not going to make your alcoholism worse. So it'll make your symptoms better, but it makes your disease worse, right? So if you think about what we're doing for insulin, we're making the symptoms better. Your blood sugar is great, so your doctor feels great. He's doing a good job, but you're falling apart. That's the problem, right? You simply can't treat a hyperinsulinemic state with more insulin. That's crazy. We know that type 2 diabetes, you have very high insulin levels. So our knee-jerk reaction, of course, is to give more insulin and wonder why people are getting worse. It's pretty obvious why it's getting worse. You're hyperinsulinemic. Why are you giving insulin? Are you a retard, right? That's the question you have to ask. That was very non-PC, by the way. So now if we go back to what we're talking about here, these are the things that lead to a cure, and these are the things that lead to worsening diabetes. Well, what do all these things have in common? They all increase insulin. You're going in the wrong direction. And these things all decrease insulin. So therefore, your diabetes is going to get better, right? And that's what we can do. We have all these millions and millions and millions of people, and we're just going this way. And we teach it in the universities, and we teach it to our dietitians, and we teach it to our diabetes education centers that, hey, you need to eat low fat. Hey, you need to take your drugs, right? But all the while, they're getting worse. It's a disease of too much insulin. So the truth number 2 is that the cure for type 2 diabetes is not to lower your blood sugars. That's just irrelevant. The cure is to lower the insulin, because that is the actual problem. So this is the hormonal obesity theory. So there's a lot to it. We didn't go through it all yesterday, but the key player in this entire thing is the insulin, right? That's what you got to focus on. And there's a lot of things that contribute to increased insulin. There's this whole insulin resistance. This I think is the main problem, but there's also protective factors, right? Fat, dietary fat is going to help reduce your insulin, for instance. Vinegar, right? Sauerkraut, lactic acid, vinegar, acetic acid, all very traditional sort of remedies for high blood sugars. And guess what? They actually work, but not very well. Fiber, which is what we talked about. There's proteins and incretins and cortisol. Dwarf wheat, which is what Dr. Davis talks about a lot, and maybe that is contributing. But there's a lot of contributing factors. But once you know what you're trying to do, which is lower insulin, then you can target any of these, right? The major one is still going to be the refined grains, right? But this insulin resistance, this fructose, I mean, there is no way anybody should be taking in sugar, right? And that's the main message that almost everybody agrees on, except those calorie people, right? They're like, yeah, you can take sugar. It's only 100 calories, right? You cannot, because it leads to insulin resistance. And it's actually worse than that, because not only does the insulin resistance lead to the entire metabolic syndrome, the hypertension, not so much. There is a link there, but it's actually not as tight as everything else. But you got to realize that this increased insulin level leads to obesity, leads to the high triglycerides, which is very typical of diabetics. It gives you diabetes, it gives you fatty liver, it gives you all of the metabolic syndrome, right? These are all diseases of hyperinsulinemia. So the obesity didn't cause the diabetes, the obesity didn't cause the fatty liver, they're all caused by insulin. And the problem, of course, that you have is that as you develop the metabolic syndrome, it leads to all these diseases of civilization. So your heart attacks, your strokes, your periodontitis, everything, all your complications, your retinopathy, your amputations, your peripheral vascular disease, everything that we deal with all comes down to hyperinsulinemia, right? But now that you know, you can actually treat it. And the good news is that it doesn't require any drugs. It doesn't require any surgery. The thing is that you can cure this. And think about it for a second, right? If you don't have diabetes, you cannot get diabetic nephropathy. If you don't have diabetes, you're not going to get diabetic eye disease. If you don't have diabetes, you're not going to get diabetic nerve damage. It's impossible because you don't have the diabetes, right? And it can all be done with no drugs, no surgery, and virtually no cost, right? There are miracle drugs out there for hepatitis C and HIV and stuff, but they're very expensive. So you can't cure those people without those expensive drugs. That's not what we're talking about here. This is a treatment that's available to you and me and to everybody in the world because they can do it. The only thing it requires is the knowledge and the courage to challenge the conventional thought because we're just going in the wrong direction, right? And I know what you're thinking. It's time to get started, but what do I do? What do I do? Well, really, the place to start is right here, right? This is what we're trying to do here. We're trying to change the world because it can be done. You've seen it in our patients, we've seen it, but we have to get the knowledge out to people that, yes, this is a disease that can be cured, right? And if you're sitting there and you're thinking, okay, yeah, but what do I actually do, right? I don't know enough about it. Well, there's programs that can be helped. For instance, if you go to my website, theintensivedietarymanagement.com, you can get your patients to join our long-distance program, right? The world is only a mouse click away, and we'll provide the dietary counseling. And as physicians, you monitor the sugars, you monitor the blood work, and so on. That's a program that's available. We have patients from New Zealand, we have patients in the UK. As long as you have an internet connection, we can help people, right? That's the most powerful thing. It's time to get started, right? Because we're so far behind. We're 30, 40, 50 years behind the ball here. And we have people who are dying of their diabetes, right? Dying of their heart failure and so on. But we don't have the knowledge and we don't have the courage to change the world. There's a world of type 2 diabetes out there, right? And that world which is full of heart failure and full of heart attacks and strokes and blindness and dialysis, amputations, obesity, that whole world changes today because we can do this. This is something that's available for everybody. Thank you.